Dr. Harrell, classmates, and anyone else who may be watching. My name is Shea Seckbach, and I am a student physical therapist assistant. And today we'll be discussing the treatment plan for a patient who is 28 years old. He's a painter, and he just had his right rotator cuff surgically repaired 6 days ago. And that was after 3 months of progressively increasing symptoms. Due to his job, he has a lot of continuous overhead activity and just overuse, leading to impingement of his right supraspinatus tendon, and that's why he had to have surgery. Subjective findings for this patient today include pain pain that's caused by sitting without using his sling or any kind of support for his right arm, and then also pain with any active movement. And objective findings include passive range of motion for his shoulder flexion. His right shoulder is 0 to 80 degrees, and a painful surgical incision. Because my patient has limited shoulder flexion and pain, I'm going to be doing a grade 1 glenohumeral posterior glide. And Andrew, if you'll let me get your arm here, I'll support it so there's no active movement. Alright, could you scoot toward me just a little bit? Thank you. So I get in position, I'll support his arm. And then we're doing grade 1, so there's just a slide. Just use your body. We just want a slight movement with grade 1, that helps with pain. He had pain and limitation with grade 3 and grade 4 posterior glides in the objective findings. And the reason is grade 3 and grade 4, they both reach the capsular edge and stretch it out. But for grade 1 and grade 2, you don't really reach the capsular edge. And there's just small oscillations, and that helps with pain. And we would do this for about 5 to 10 minutes, and that'll help relieve some of his pain just by giving a slight distraction to his shoulder. Does that feel okay? To help reach our patient's goal of increasing passive range of motion to help with easier dressing, I'm going to show him an exercise that he can do at home to help increase his passive range of motion and flexion. Okay, Andrew. So in order to help you get dressed easier, just to help with your range of motion, and also eventually just to help get you back this motion that you use when you paint, I'm going to show you an exercise that you can do at home to just help increase that motion, okay? Alright, so you can just sit in a chair beside a table, and I know you can only get up to about right here now, so just get your arm up on the table, and you're just going to slide your arm forward and just kind of bend at your hips. So you're just going to go forward and just straightening out this arm. And then when you get as far as you can without it being too painful, just hold it for about 3 seconds and then just come back up. And do it again. Okay? You do this 10 times. Alright, and that's 1 set. Then you can take a break and do 3 sets of 10. And we're going to do it 3 times a day. Okay? I'll let you try that. Yeah, you can use your other arm, just help get it up there, because you don't want any active movement, so be sure you're using your other arm to lift that up there, okay?
Okay.
Alright, and then just slide forward, just straighten your arm out. Just go to where there's not too much pain. You'll have a little bit of pain because you just had surgery, but you don't want too much pain. So go as far as you can, hold it for about 3 seconds, and then just sit back up, and then do it again. Alright, and how many times do you do it?
You said 10?
3 sets of 10.
3 sets of 10.
And then 3 times a day. Hold it for 3 seconds. 3 is our number.
Oh, that's going to be rough.
I know. Like I said, you don't want too much pain. You know, so when it gets to that point, just stop And the more you do it, the further you'll be able to go. This will help loosen that up and help you stretch, okay? Since this patient has pain with certain movements, such as active movement, lying on his right side, and then also increased symptoms when he's sitting without his sling or any support, I'm going to give him some patient education to help deal with these issues. Okay, Andrew? I know you said you've had some increased symptoms, like when you're sitting without your sling, or you said when you're sleeping, and then also if you have any active movement.
Yes.
So first of all, doctor's orders for the first 4 weeks are no active movement. So you don't want to do anything active, just when you're moving that arm, you want that arm supported.
Yeah.
And if you have to move it, use your other arm, or just don't, you don't want any kind of active movement. Okay, and another is when you're sitting, I know you like to take a break from wearing your sling and things like that. So when you're sitting without your sling, you still need some support under that arm. So if you're sitting in a chair like this, the arm still may not be high enough to support your arm. So you can always add a pillow to it and just kind of put your arm up on that. And if one pillow is not enough, you can double it up or just add more pillows. You always want some support so that your arm's just not hanging.
Okay.
Because if your arm's just hanging there, those muscles may try to contract, to where they're active. And you don't want active just yet. You want passive, to where you're doing the movement,
Okay.
to where, something else is moving your arm, not your arm moving itself.
Okay.
And then the others are just, when you're sleeping, just be sure you're not laying on that right side. You can lay on your left side or lay on your back, but don't lay on that right side. So, was there any questions that you had about anything?
I don't think so.
Okay. So just remember, no active movement, and just keep that arm supported at all times, okay?
Okay.
The prognosis for this patient is very good. As long as he follows doctor's orders and he's compliant with his physical therapy program, he should regain full function, same function he had prior to his injury, in about 6 months' time, depending on the extent of his injury, and with no modifications. And he should move on to the next phase of his rehab in about 6 weeks. And he had a rotator cuff repair done to his left shoulder about 2 years ago, and he's regained full range of motion, full strength in his left shoulder. So I'm hoping, since he's young and strong, hopefully he'll have the same results with his right shoulder. Thank you very much for your time. If you have any questions, just post those on Blackboard, and I'll do my best to answer them for you. Thank you.